Hi, I'm Dr. Justin Ledesma. I'm a spine surgeon here at Plano Orthopedic, and today we're going to talk about lumbar disc herniation. So on the screen, we have an MRI scan of a recent patient who was 47 and came in with left leg pain. Leg pain had been going on for a few months. She tried physical therapy, tried medications, and even had some injections, but her symptoms were just not getting any better. And as you can see on the MRI scan, we have at the very bottom level here a large disc herniation and protrusion at the L5S1 level that is pushing out, and on this screen, the right side of the screen is actually the left side of the body. So we can see this protrusion here of the disc herniation that's pushing into the spinal canal and pushing onto the nerve. You can see the nerve, which is this little dot here on the right side. That one is nice and free, where there is this one, there is this disc herniation that's compressing it. And nerves don't like being compressed, and as a result of that, that can produce pain that will radiate down the leg. So given she had exhausted all non-operative management, we discussed proceeding with surgery. So the surgery for treating something like this is what's called a discectomy, which is where we go in and remove the piece of disc that's pushing against the nerve to free it up so that it can be relieved of that compression and help with the pain. And the way that this procedure was done was through what's called an endoscopic approach. So this is through a small incision on the back about the width of my fingernail, so about 7-8 millimeters. And we go down with a camera in order to directly look at the spinal canal and the nerve. And we move the nerve out of the way and then remove the disc that's pushing against the nerve. And by doing so, the nerve is relieved of the compression, and this is very, very good at relieving that type of leg pain. So this is a picture during the surgery. You can see the tube that we're looking at, and that is the piece of disc that we were able to identify and remove with little graspers. And following taking out all of that disc, then we can see that the nerve is decompressed and is not being pushed on anymore. This is a picture of the nerve, which is this structure here, and the disc is underneath it. And this is after removing the disc herniation. We can see that there's a nice shadow that goes underneath the nerve, indicating that there is no pressure now pushing on that nerve. So in this particular patient, we were able to get a post-operative MRI, and on the screen you can see on the right side is the preoperative image showing the large disc herniation pushing against the nerve. And on the left side of the screen here, you can see now that nerve, which is this little dot here, was previously unable to be visualized because the disc herniation was pushing against it. And after removing the disc, we can now see that nerve very clearly. So after removing the disc fragment and removing the compression on the nerve, this is a very successful type of operation for relieving leg pain. Postoperatively, patients are able to go home the same day. You're able to walk right away. Really, the restrictions are no heavy lifting, no real strenuous activity for a couple weeks. And then once recovered, then essentially there's no restrictions and you're able to return to full activities. Again, I'm Dr. Justin Ledesma, spine surgeon at Plano Orthopedic. If anybody has any questions, please feel free to leave them in the comments below, and we will try to get back to you and answer them as soon as we can.